Hi, my name is Wendy Leonard. I'm a registered dietitian and nutritionist, and I'm the owner of Rhode Island Nutrition Therapy. And today I'm going to be talking to you about the FIT test. And what the FIT test is it is a food inflammation test, and it's testing for 132 foods, additives, herbs, spices, and food colorings, etc. I started using this in my practice a few years ago. I had a patient come in with his results, and he was like, "Can you help me come up with a diet, utilizing these results?" And I was like, "What is this? Oh my gosh, okay." So I just went ahead and worked with him on creating a meal plan with his with eliminating his food sensitivities. But I was quickly a firm believer, because within a week his GI symptoms had gone away. Within 2 weeks his headaches and migraines had gone away. Within 3 to 4 weeks his joint pain and inflammation had gone down, and he said that he was feeling better than he had felt in 20 years. So after that, I started having even family and friends try it. My daughter took the test. She'd always had some GI issues, and I was amazed at how much better she felt when she followed the elimination diet. I also had some other family members do that, and their headaches as well as stomach issues went away immediately. And when they do include some of those foods, again, especially in the high sensitivity category, the symptoms come back. So this is the test that I'm using. It's the food inflammation test by KBMO, and I think that this is interesting. It helps patients with the following symptoms: anxiety, depression, bloating, stomach pain, inability to lose weight, impotence and libido problems, fatigue, insomnia, joint pain, constipation, diarrhea, and sugar cravings. So this really can be helpful for pretty much everybody. Inflammation is at the basis for chronic disease, but also just symptoms as well. And by eliminating these foods, you can really improve your quality of life on a daily basis and prevent chronic disease on a long-term basis. The foods we test, this is online, but the foods we test, this is the 132 foods, additives, etc. that this test measures. And I don't know if you can see this, but I'll have this available for download too. But it includes, just to name a few, dairy, grains, additives, beans, spices, vegetables, fish, shellfish, fowl, meats, microbes, and nuts. I also want to show you the results quickly of a patient. I've crossed out her name, but this is what you can expect. You'll have a cover sheet with these 3 different categories. This is your 4+, 3+, and 2+ reactions. Red is going to be the severest reaction. 3+ is orange. That's going to be a high reaction, and 2+, the yellow, is a moderate reaction. So this is how it's going to quantify what sensitivities you have. This will also be included as well. This is the chart looking at the 132 foods. The ones in dark green, this patient has no sensitivity to, so she will know that these foods are safe to eat, but it shows the different levels of reaction that she's having. So this is great data to have too for yourself. Okay, so this is the FIT test. It comes in this kit right here. I send this home with my patients. I don't do the blood test in my office at all. I don't like to deal with blood. So I will be sending this home to you, with you, but I'm going to do it today. I've had so many patients do it, so many family members, and I've had a few friends do it, but today I'm actually going to be doing it. So I'm going to walk you through that. So if I open up my kit, inside I have this sheet right here that you'll have to fill out, and I have to sign it at the top. So I will have this signed when I send this to you if you're interested, or if you come into the office. So I already signed it for myself, and I'll fill out the rest later. I also have in here a sealed bag. So this is biohazard bag. It's sealed. No one else has touched this by the time that you get it, and I will show you in a second what's in there. I also have this card too, which is going to have the directions for how to fill out the card, and it shows you examples of the correct way to fill it out and the incorrect way to fill it out. So that will be available for you as well. And then inside too, there's an envelope. It's already addressed to the lab, KBMO, that we use, and it's already stamped as well. So we'll be using this too. So inside here, if I open that up, I've got my alcohol prep pads. I've got the card that I'm going to fill out, and I also, to show you the spots here, what it is that I'm filling out, that's where I'm going to put the blood to be sent off, and that's what they're going to be testing against, these foods and additives. And then also in here is the Lancet. The needle is inside the Lancet, so it's a one-time use. It will, when I press on it, it will come out and prick my finger, and then the needle goes back inside, but that is also to be disposed. So I will spare actually showing you me pricking my finger, but what I'm gonna have you do is wash your hands thoroughly with hot water. Make sure you're really hydrated, because otherwise it may be a little hard to get all that blood flowing. And then clean your fingers with the alcohol prep pads that are included here. And sometimes I'll also recommend like hang your hand down low for about 30 seconds to get the blood flowing. And then if you're still having problems, do a few jumping jacks, maybe like 25, and then that should help. And put that blood spot on there, seal it up. You're gonna write your name and the date of collection here. You're gonna put it in the envelope, and you're gonna mail that out, just regular mail. And then within 7 to 10 business days, you'll get your results in an email. And then I will go over those results with you. There's a meal plan that comes with it. And then if you have any questions along the way too, I'm also available. So with these elimination, the foods that come back on your elimination, it's a 4 to 6 week elimination. And then at that point, you can start adding back in some of the foods that are in the mild and moderate reaction categories on a rotational basis. So every 3 days, you can add a small amount of one of those foods back in and then track to see if there's any reaction. Most food sensitivities, there's a 3-day delay. So that's why when you reintroduce, it's gonna be every 3 days, so you can isolate which food may still be causing problems. So, but I guarantee that you'll be feeling a lot better within a week. Many symptoms will be improved, especially those GI symptoms. And then within 2 weeks, you're gonna see other systemic inflammation going away, like headaches, migraines, if you're having those, but other inflammation, like as far as joint pain or swelling, everything should be improving. And then things that are even unseen, you're preventing the future diseases, chronic diseases, and inflammation is being connected to a lot of things right now: cancer, diabetes, heart disease, thyroid problems. So you're really helping yourself by getting this information. Having this data, knowledge is power. So you can go online to www.rinutritiontherapy.com. You can order the test kit there. It's $350. It's worth every penny. Also, you can email me if you have any more questions. It's wendy@rinutritiontherapy.com, and I'll have a link to the website for you to purchase that if you want. But please, if you have any questions, just shoot me an email and I'll be happy to answer any of those questions for you. All right, thank you. Happy New Year from Rhode Island Nutrition Therapy, and I'll let you know what my results show. Thanks, bye.